Good evening, y'all. My name is Joe Durant. I'm one of the instructors with Dolphin Neurostim and the Center for Pain and Stress Research. And tonight we're going to be doing a tutorial on how to use the Dolphin Neurostim for treating scars, for treating acupuncture points, and also for doing vagus nerve stimulation. So we're going to do about an hour or so of instruction, and we're going to have about 30 minutes of question and answer at the end. So you guys can ask some questions about what's going on. And I've had to switch over to a different camera here. So if anybody can't see anything, please do send us a message. So this equipment comes in two basic configurations. Either comes as a Dolphin Neurostim kit or as a professional kit. This will typically have two Dolphin Neurostims in it. This will typically have one in there. So I'm going to start out by going over the features of the Dolphin Neurostim for you guys so you can see how to use it. So if you have a Dolphin Neurostim available, if you will pull it out, then we'll start going over things. So I'm going to start on the front side of the Dolphin Neurostim, and you can see there's a big button, a small button, and a roller switch. So starting at the top here, we have the treatment button. So as long as you hold this button down, you're doing a treatment. When you release that button, you stop doing a treatment. The unit has to be on, of course, before you can do that. The next button down is your on and off switch. So when you turn this on, you should hear a beeping noise. And you'll notice that it rolls. So the more you roll this switch, the more voltage it puts out, the more intense the stimulation is. When you turn it on, if you turn the unit around to the back, you will see a green light that comes on. This is your battery test. If that green light does not come on, that means that you have a battery that's going to be going dead before too long and you need to change your batteries. So while we're on the topic of batteries, I'm going to go ahead and show you guys how to change the batteries in these. So before we start doing that, I'm going to point out something. You'll notice on the back of this device, there are two screws in there. If you take those two screws out and you open this device up, you will void your warranty. So there actually is a battery compartment in there. Right here, you'll see it. It's got some writing on it. This is how you access the battery. I know that seems a little odd, but we do actually have a lot of people sending devices back because they've taken them apart in an attempt to change the battery out. And about 90% of the return inquiries we get on these devices are because people are having battery problems and they don't realize they need to change the battery. So again, with the roller switch on the front, if you turn the device on, rotate it to the back, you should see a green light. If you don't see a green light, you need to change the battery. So I have a device here. It's one of our older devices, but I've set it up so that, well, let's see here. Anyway, I've set it up so I can show you guys how to change the battery. So to change the battery, you either need a screwdriver, a coin, or a knife of some kind that you can pry this compartment open with. So I'm going to use a quarter. I'm just going to take a quarter and pop this battery compartment open like this. I'm going to use the same quarter to pry the battery out. And there's your 9-volt battery. Now you'll notice that there are no wires and no little pads. So a lot of devices that have a 9-volt battery have some wires and a pad that you have to attach this to. We did away with that because those tend to break. So what we did was we built a compartment into this that should fit most 9-volt batteries. But I will go ahead and give you a word of warning. Not all 9-volt batteries are the same size. Size AA batteries are all the same. Size AAA batteries are all the same. D batteries and C batteries are all the same, but for whatever reason, 9-volt batteries do not all come in the same size. Some are slightly shorter and some are slightly longer. So if you get a battery that's too short, when you put it in the device, it's going to rattle back and forth and give you intermittent contact. If you get a battery that's too long, it's not going to fit in the device. And if you try to squeeze it in there, it's actually going to push the circuit board around. So we recommend that you use either Panasonic batteries, which I typically don't see in the store. We buy these in bulk to use for the devices. This is a good battery. Duracell batteries work very well for these devices, so I really recommend the Duracell batteries. And most Energizer batteries will fit in these devices. However, There are some Energizer batteries that won't, that are made in different factories. So outside of that, I would stay away from other batteries, especially rechargeable batteries, because the peak voltage on rechargeable batteries is not as high as a peak voltage on a regular alkaline battery that you buy. So what will happen is you will very quickly get into a voltage range as the voltage depletes, that the device is not going to work properly. So take your new battery, put in the device. It's going to be a tight fit. And when you go to put the battery cover on, slide it down, it's going to feel like it's going to break. It will not. If you push, you'll hear a solid click, and the device will be firmly closed. And you're ready to go. So you can check it by turning the device on, turning it around, and checking for your battery. Checking for your battery check light. Again, if that green light does not come on, you need to replace your battery. Other features of the device, like I said, when you turn this device on, the more you roll it, the more intense it is. So it's designed so that as you're treating a patient, you can roll this switch up or down to get into your patient's comfort zone. Beyond that, there's a smaller button. When you push this button, that's going to put this device into a constant treat mode. When it's in a constant treat mode, it's going to cause the battery light to flash like this. And without touching the treatment button, it's going to continue to do treatments for anywhere from 12 to 14 minutes, after which it'll go back into what we call search mode. So when you first turn this device on, it's in search mode, and you can use it to find acupuncture points. But as soon as you either push this button or push the constant treat button, you're doing treatments. So on the back of the device, you're going to see several things. You're going to see a shiny metal plate, and you're going to see two slider switches. The top slider switch is marked polarity. So you'll see a negative polarity sign, a positive polarity sign, and what we call a biphasic polarity sign. So these devices are direct current, so that when, depending on how you adjust the polarity, it will either push electrons out to the tip or draw electrons into the tip. That becomes useful when you're trying to either relax muscles or bring up muscle tone. In the books that come with the device, you will see pluses or minuses next to each of the acupuncture points, and that will indicate, and treatment points, and that will indicate the polarity you should choose on your devices. If you are following a protocol and you do not see a polarity mark, generally speaking, the negative polarity is a polarity that you want to use. Typically, most of the things you deal with are going to be conditions of excess. So that's going to be things like too much pain, muscles that are hypertonic, scar tissue that's very tight, conditions you want to go away like headaches or painful conditions of one kind or another. All right, so below that, there is something that says wet, normal, and dry. If you read right there. And so that slider switch adjusts the sensitivity of the tip of this device. So the tip of this device has an ohmmeter, as you pull it across the skin, has an ohmmeter built into it, and it allows you to test the electrical resistance of the skin. So essentially what that does is it allows you to find myofascial trigger points, motor points, and acupuncture points. All of those are more conductive than the surrounding skin. So if you gently pull this across the skin, you're going to be able to locate those points. It's one of those things, it's a really nice feature, and we worked a lot of years to get this as accurate as we can. And at some points we made it a little too accurate and had to back it off just a little bit so that you had a little bit of margin of error there, so you know when you were close to the points. So not everybody's skin is the same. Some people have very wet skin, they're sweaty. Some people have just normal skin, but then you get into colder climates, or you get into situations where you're dealing with elderly people who are in nursing homes, or they don't drink enough water in general, and they have very dry skin. So you need to have a more sensitive device to find treatment points for them. So this metal plate on here, when you are doing treatments, you must have your thumb on that metal plate. If you do not have your thumb on that metal plate, you're basically just doing acupressure or some kind of point therapy. This metal plate allows you to complete the circuit and allows electrons to circulate back into the Dolphin Neurostim to complete the circuit and finish your treatment. So when you are holding these, they are designed to be held like you would hold a pen. So if you let the device sit in the crook of your thumb and place your middle finger over the button like this. So this is how you would go about treating your patients. That allows you to set your hand down like a fulcrum so that you can use your fine motor skills to locate these treatment points. And some of these acupuncture points are very small and do require that you move slowly. So if you hold your hand up over the patient, it's very difficult to find points. It really is quite useful to be able to rest your hand down. The other thing that's very important is that when you're doing these treatments, you need to have some kind of skin-to-skin contact with your patient. So this device works by putting electrons either into the patient or drawing electrons out. But the electrons have to have a place to circulate back into the machine or get into the patient. So with this device on a negative polarity, if I turn it on, put my thumb over this metal plate and pull it across the patient's skin. If I'm touching the patient like this, then I make good skin contact. And when I find a treatment point, you'll see that you get a high pitch and the light goes out. But if I take my finger off of that metal plate, you'll notice the light comes back on and the pitch goes back again. So it's necessary to maintain skin-to-skin contact with a patient. You can't just touch the clothing. You have to touch them somewhere on their bodies. So they could put their hand on your neck. You could put your hand on their arm, on their back, however you want to do it. The more skin contact you have with the patient, the more conductive the device is going to be. The less skin contact you have, the less conductive it's going to be. So if you're having difficulty locating points on a patient, you need to have a little more skin contact. Sometimes you'll need to moisten your hand with a little bit of water or something like that for your skin contact because their skin is so dry. So those are all the features on the device. The tip here is spring-loaded. So it's set up so that it will not break the skin unless you were to just stab on somebody with really, really fragile skin and rip. Other than that, you're not going to break the skin anywhere. That being said, you should still be careful when you're working with people with delicate skin that's been burned or they're older. So I believe that has us covered on all the features of the device. So what I'd like to do now is walk you guys through how to find a few acupuncture points. And let me see here. We're going to start with some acupuncture points that are in the wrist. So let me show you what we're going to find here. I just got done teaching a workshop this weekend. We do teach in-person workshops. I just got teaching one down in Durant, Florida. We had about 20 people there from all walks of life. We had everyone from physical therapists to acupuncturists to doctors to massage therapists to occupational therapists and a little bit of everything else in there. Okay, so we're going to be locating these 3 acupuncture points you see right here. And this is actually the manual from the workshop. And we actually do have another workshop coming up in a couple of weeks that's going to be on auricular acupuncture. It's on ear acupuncture and scar treatment. So if you guys are interested, make sure to get in touch with the office and then get you signed up for that. And then a few weeks after that, we're going to have another workshop on post-concussion and traumatic brain injury. So we've got a series of workshops coming up, and there are also some we have online. Okay, so to locate the acupuncture points so you guys can use this device to find them, if you take your hand and bring your wrist forward, you'll notice there are lots of creases under there. But if you bring your wrist back, you'll notice that there's only one crease that follows the base of the palm of your hand. So I'm going to draw that crease. And I've drawn that crease in red. So we're going to call this the reference crease. So by calling it the reference crease, I'm indicating to you that we're not going to find any acupuncture points on that crease today. We're going to use that crease as a way to locate some other things. So if you then take your wrist and bend it forward, you'll see there's another crease about the width of a ballpoint pen below that. And I'm going to mark that crease on my wrist in blue. So at this point, you're going to have two creases on your wrist that are about the width of a ballpoint pen apart, okay? And if you've got that, so we're going to call this blue crease the treatment crease. And we're actually going to find a couple of acupuncture points on this crease. So adjust the camera here so you guys can see this just a little bit better. If you go to the thumb side of the blue crease, the treatment crease, and push in, you can actually feel your pulse. So that's the radial artery. If you were using needles, trying to stick them in acupuncture points, you wouldn't want to stick a needle through the radial artery. So if you come just to the center of the pulse there's a little hollow. You'll feel a little groove right there. So I'm going to mark that with a little star like this. And that's an acupuncture point that's called lung 9. Lung 9 is an acupuncture point that is used for chronic respiratory conditions. It's also known as the vascular source point in acupuncture. So it's used for anything having to do with vascularity. It can be used to control blood pressure that gets out of control. We have used it successfully with high blood pressure during pregnancy. So anyway, it's a very useful point, and it serves as an emotional point for grief. The lungs are associated with grief in acupuncture. So I'm going to turn my Dolphin Neurostim on. I'm going to check that the light is green to make sure my battery is good. I'm going to put my thumb on the metal plate to make sure that the electrons can cycle back into the device. I'm going to set this down on my wrist and pull it across the treatment crease. I'm going to set my polarity on negative because I want to bring things down. This is a parasympathetic calming point, and I'm going to set the sensitivity. My skin's a little dry this evening, so I'm going to set the sensitivity on dry, which is going to make it a little more sensitive. And I'm going to flip this around so you can see. As I pull this across the skin, you'll notice when I get over the area where I have a star, you can hear a high pitch and the light goes out. So that indicates I've got an acupuncture point. Now I am going to give you a warning. If you take this device and you push really hard, you will get false positive indications. So you have to use it gently. Set the unit down and pull gently across the skin. I guess my skin is a little wetter than I thought. All right, there we go. So you're going to pull across there, and then you find your point. Once you find your point, you're going to put your thumb on the plate and push down. For each acupuncture point, you want to count out about 20 to 30 beeps. And once you've done that, you move on to the next point. All right, so the next point we're going to find is on the opposite side of this blue treatment crease. So we're going to draw a line from between my pinky finger and my ring finger straight down. And there is a hollow right there by the tendons. So if you stick your finger in, you can actually feel it. So where these two lines intersect is your acupuncture point. That acupuncture point is called heart 7. Heart 7 is another parasympathetic calming point. So it brings your system down. And you will notice that there are some tendons that come through there. So acupuncture points tend to be in dips and hollows. So if I had to give you a piece of advice in locating important acupuncture points, really important acupuncture points tend to be in dips and hollows on the body. So they tend not to be on top of tendons and things like that. You have to kind of put yourself in the shoes of somebody who might be putting needles in someone. You definitely don't want to put needles through a tendon. So again, I'm going to take my Dolphin Neurostim, I'm going to turn it on, make sure the light is on. I'm going to put my thumb on the button here, and I'm going to pull this across. And again, the light goes out and the pitch goes up. So that tells me I'm over the acupuncture point. And I'm going to hold the button down for about 30 beeps. Heart 7 is known as the Valium point in acupuncture. It's a really good calming point. The heart meridian in acupuncture is known for calming the mind. So the heart is considered to be the emperor, and it rules all. So your heart actually overwhelms your mind. So anytime you have overthinking problems or your thinking is cloudy or fuzzy, heart points are a good thing to use. Along those same lines, this point, heart 7, is an acupuncture point that you might incorporate into a stroke treatment for a patient or a traumatic brain injury for a patient. It's one of the points you'll find is useful for that. All right, so we're going to go over one more acupuncture point, then we're going to move into something different. So if you go from the red line, which is the reference crease, I'm going to flip my hand around here so you can see it. If you go from the reference crease, if you take 3 fingers like this, and you go 1, 2, 3 fingers, and take your thumb and place it next to your index finger between the tendons right here. If you push in and bring your wrist up, you'll find that it's tender right there. So that's an acupuncture point known as P6, pericardium 6. So you can see that I've got an acupuncture point marked. Well, it moves once I switch my wrist around. But anyway, you can see right here, I have pericardium 6 marked. Again, 1, 2, 3 fingers, then put your thumb next to your index finger and push down and flex your wrist up, and you'll find that it's quite tender right there. So pericardium 6 is an influential point in acupuncture. It's a distal acupuncture point that influences the proximal area of the body. So this particular point influences the chest. So it's a really good point for any kind of chest problems. It's not a problem-specific point. It's an area-specific point. So it could be chronic asthma. It could be a COPD. I used this point when I had COVID. It was useful in bringing up my my blood oxygen saturation. It's also a point that is really good for nausea and morning sickness. So I used it when my children's mother was pregnant to control nausea during the morning. It worked well. And both my children, when they were in kindergarten and preschool, their teachers were actually pregnant. And I would go in the mornings and I would treat their teachers on this acupuncture point to bring down their nausea. And that would hold them up until about lunchtime. And usually they were good after that. So it's a really useful point. It's also good for motion sickness. So if you have problems when you travel, this is a point that you might find useful. All right, so we have these 3 acupuncture points, which together make up what's known as the golden triangle in acupuncture. So these 3 points are parasympathetic calming points. If you treat these 3 points on both wrists, you'll find that it significantly calms down a patient's level of sensitivity. Some of our other instructors that I work with actually have their patients trained to come into their clinics. They have devices available, and the patients are taught to treat these points on either wrist before they go back and actually have their treatments. So again, really, really useful points. You'll see these points come up in our workshops. And I'm going to take a little alcohol here and wipe this off so I don't get ink everywhere when I continue to teach you guys this evening. All right. So those are the basics for locating acupuncture points. Again, you need to move very slowly with this device and very deliberately. If you move quickly, you're going to slip over the points and you're not going to notice. So I was watching people this weekend as I was teaching, and there were some people who would go directly over the acupuncture point and the light would just barely flicker. And they thought that they weren't anywhere close to the point. But the problem was that they had moved so quickly that the machine didn't have really time to detect the point. So again, I would urge you to move slowly with this. The other thing I would tell you is if you're first starting to use these devices, there is a little bit of a learning curve for finding treatment points. Do keep in mind that this is electricity, and because it's electricity, there is a margin of error built in there. So if you're anywhere close to the acupuncture points, you are typically going to get a good response. The closer you are on top of the point, the better your response is. But even if you're pretty close, you're going to get a good response from your patient. The other thing I'll tell you is that When I'm doing treatments, I rarely ever watch this light. I don't really look for the light to go out. I listen to the tone, because the electrical resistance of patient's skin will vary from time to time. And you'll get some people who just don't have very conductive skin at all. Sometimes you actually have to take a paper towel, dampen it, and then wipe it across the patient's skin and then dry it to hydrate the skin enough to be able to locate points. So towards that end, don't get upset if you can't make the light go up. Just listen to the tone of the device. Okay. So we're at about 7:30 right now. So we need to go over how to treat scars and how to do vagus nerve stimulation. So the next thing we're going to do is go over scars. To treat scars, you need 2 Dolphin Neurostims. So treating scars is a game of electrons. It's a game of playing ping pong with electrons back and forth through tissue that is very non-conductive to electricity. So if you try to measure how conductive scar tissue is, it's hardly conductive at all. And that becomes problematic because we're trying to run electricity through it. So that's why you need 2 of these devices. You need to be able to go on either side of the scar and push electrons from one side and pull them to the other side, and then pick them up and throw them back over. So you're basically playing ping pong with electrons back and forth through the scar. And as you continue to do that, it infiltrates the scar with electrons and repolarizes the tissue, and that increases the capacitance of the tissue. And when that happens, the scars actually become less dense. So let me draw a scar here. There are 2 basic scar presentations that you will see. You have your typical linear scar like this, surgical linear scar. And then you have your burn or puncture scar, which tends to look more like this. So in either case, the treatment is almost exactly the same. So I'm going to actually tape this to myself so I can show you guys how to do this. This is actually a little more effective than trying to do this on a whiteboard and see my face at the same time. So let me draw one more good scar here. Okay, so we're going to pretend that I have an open heart surgery scar. Yes, you can use these over the heart after heart surgery. And in terms of precautions, these are considered to be an eStim device. So if you want to use them over something like a pacemaker scar, you really should get the physician's approval first, unless you happen to be a physician yourself, in which case you can make the decision. But if you're not a physician and there's a pacemaker or a defibrillator involved, you need to get the physician involved first. So what we want to do with this scar is we want to use a negative polarity on one side of the scar like this, and we want to use the biphasic polarity on the other side of the scar. So on your Dolphin Neurostims, one of them should be set on the negative polarity like this. The other one should be set on the biphasic channel. So you're going to flip it all the way over to the plus minus symbol there. Okay, so you have one on negative and one on biphasic. It doesn't matter which hands it's in, because you're going to be switching them back and forth in a little while. So the negative polarity pushes electrons in one direction. Biphasic channel acts to pull them across and then picks them up and shoots them back. So again, like I said, it's like playing ping pong. So what you're going to do, these devices, you're going to have one on either side of the scar. So you're not actually going to go, when you start out, you're not going to start out on top of the scar tissue, because the scar tissue is not terribly conductive. You're going to start on either side of the scar. So you're going to hold your devices for about 10 beeps. Pick them up and move about 1/4 of an inch or so. 10 beeps. So every 1/4 of an inch, you're going to move these devices down, and every 10 beeps. So what you're doing is you're looping electrons through this scar tissue. okay? And the more you infiltrate the scar tissue with electrons, the better your outcome is going to be. So there are different ways of treating scars. Some people try to use devices like gua sha, like scraping devices. Some people try to use cupping devices. This happens to be an electronic cupping device. Some people will use acupuncture needles, like this one, and needle them. And some people even inject scars. And one of the original scar techniques was to inject scars with procaine, which has an electrical charge that repolarizes the tissue as well. The problem with injecting scars is that it only repolarizes the scar tissue to the extent that you infiltrate the tissue with the procaine. So if that procaine doesn't touch the scar tissue, those areas of the scar are not going to let go. When you're using electrons, that's not an issue. You can also use electricity to release scars that you typically wouldn't try to release using needles. So if somebody has deep abdominal adhesions from a C-section or hysterectomy or some kind of abdominal surgery, you can get to that with electrons. You would have a really difficult time infiltrating some of those scars with needles, either dry needling or injecting, because they're so deep. You're getting around the intestines and different internal organs at that point. So you're going to take your devices, one on negative, one on biphasic. You're not trying to find acupuncture points. You're not listening for a high pitch. You're not looking for the lights to go out. You're simply trying to pass as many electrons as you can back and forth through this tissue. So you're going to set the devices down, thumbs on your metal plate, skin to skin contact with the patients. You're going to count out 10 beeps. And you're going to do that all the way down to the bottom of the scar. Then you're going to switch the devices, and you're going to do the same thing all the way back up. So stopping every 1/4 of an inch to count out 10 beeps. And then you're going to switch the devices again. If you wanted to, you could slide the slider switches, but it tends to be faster just to switch the devices from one hand to the other. This is a game of electrons. So the more electrons you push through that scar, the better it's going to be. So generally the advice I would give you is you want the devices turned up as much as possible to increase the flow of electrons, but keep in mind that you have to stay within the tolerance levels of what your patient can stand. So after you have gone back and forth through this scar tissue and started to repolarize the tissue, it'll be conductive to some degree. Then if you come to either end of the scar with your devices and actually go on top of the scar, you'll notice that in the book, probably the book you have that came with the device, it will tell you this is called capping the scar, or anyway, if you start at either end but actually work towards the middle, again, stopping every 1/4 of an inch, counting out 10 beeps. So you can actually pass these devices back and forth by each other. And again, the more you infiltrate that scar with electrons, the more it's going to release. So what we know from the research, and we've had extensive research done on this, is that a thorough scar treatment will yield you about a 20% reduction in the overall density of the scar. So the measurement's called the cicatrix gray mean density. And if you use a good diagnostic ultrasound, you can actually see the variations in the density of the scar after the very first treatment. You'd actually see blood flow starting to work through there. And what happens when the scar becomes repolarized and when it becomes less dense is it takes a lot of pressure off the nerves that run through the area. So scars that have been sensitive and painful for sometimes months or even decades. I've seen scars that were painful for close to 70 years. Treated with these devices and desensitized in one treatment. So really, really useful tool. You will see scars that are really puckered. As you treat them, they will visibly start to relax. So if the scar is raised up and puckered, you should expect on the first treatment to see some change in the scar. It'll spread out a little bit and flatten out. If the scar is dipped in and the fascia is pulling it in, you'll see it start to come back up and become more level with the skin. So all in all, you're going to see color changes with the scar. You will feel textural changes with the scar, and you will, in many cases, see postural changes with your patients, especially if they've had thyroid scars, open heart surgery scars, explant scars, C-section scars, hysterectomy scars, scars that tend to pull your patients forward. When you release those, you'll notice the patient is able to come up more easily. Oftentimes they can breathe more easily, and definitely gets their head back up with their shoulders, and significantly impacts neck pain and back pain because the patient can get into proper lordosis. So there aren't many scars you can't treat with these. You can treat scars on the head. Things like broken bones actually count as scars. Chronic sprains and strains count as scars. And also cosmetic surgery scars. So even little thin scars that you can barely see that aren't even painful can exert pull on the fascia and cause a lot of problems for patients. So that kind of gets us through how to treat scars. We do have entire scar workshops, and getting those workshops in person is a very useful thing. Like I said earlier, we have Todd, I believe one of our instructors, will be teaching in a couple of weeks down in Durant, Florida. If you get a chance to pick up that workshop, and you'll learn a lot of good ear acupuncture points, auricular points, and you'll also learn quite a bit about how to treat scars. All right, so we've gone through how to hold the device, how to turn the device on, what each of the buttons do. We've gone over how to change the batteries, cleaning the devices. So I typically use either alcohol wipes, single-use alcohol wipes, and you just want to clean the tip of the unit thoroughly. Don't get alcohol down in here, or don't dip this in any kind of fluid, because there is a spring in there and there are things in there that have to be conductive. And if you start infiltrating that with fluid, what will happen is it will start to eventually interfere with the connectivity. That being said, I have devices like this that I have had for close to 20 years that still work just fine. So if you treat them well, they will last an awful time. You can also use things like alcohol spray to gently spray the device and clean it off with a paper towel. And I like to do that between each of my patients, just to make sure things are nice and sanitary. All right, so other items of maintenance you might want. If you have any problems, we do have a forum. So if you go on Facebook and join our forum, so if you own one of these devices, you can join our forum on Dolphin Neurostim, and you can type questions about how to use this device on different problems. If you are experiencing any issues, you can always call us, but you might get a response pretty quickly if you just post something on the forum, and typically somebody will answer you pretty quickly. The next thing we need to go over is how to use these devices for vagus nerve stim. So treating acupuncture points is something that's going to require a fair amount of practice. Treating scars, right out of the gate, you should be pretty good at doing that. And vagus nerve stimulation is quite easy to set up. So if you have the vagus nerve stimulator set up, you should have a box like this that will have a Dolphin Neurostim in it, and there will also be some cables. So I'm going to go over these cables with you guys. There should be a little bag that has probably 3 ear clips on it. Some of them are black, and occasionally some of our older setups had ear clips that are white. I was looking for one to show you guys, but I don't see one at the moment. But anyway, some of the ear clips are white. They're exactly the same. So you're going to want to pull out one of your ear clips and set that aside. You should have a white cable. This white cable comes in 2 different variations depending on when you got your device. So the white cable will either have 2 male prongs on it like this, or what looks like a male and female prong. But if you look, you'll actually see in what looks like the female prong that there's actually a prong in there. So this is still 2 male prongs. So whichever variation you have of this white cable, they're both male prongs. One is just shrouded. Okay, so you're going to need your white cable. And there's also a black cable in the device that has a metal cup on the end of it. It's got a little, if you look inside, there's a little metal plate in there and a plastic cup and a male plug on the end. So to set this up, you're going to take the cup, plastic cup, and you're going to push it onto the blue tip of the Dolphin Neurostim. You need for the tip of this to get in contact with that metal plate. If you don't do that, it's not going to work. So don't push hard, but push firmly to make sure this is seated. Once you've got that seated, I recommend turning the device on, touching the metal plate, and then touching the end of this prong. And you'll notice that the pitch goes up and the light goes out. So that tells me I actually have a good connection. Again, once you have this on, turn the device on, touch the metal plate, and touch the end of this. So that completes the circuit. The other thing that you are going to want are your electrode pads, which come in 2 variations. There are some rectangular ones like this, and there are some oval-shaped ones like this. So you would need one of the oval-shaped electrodes. You want to make sure that the metal plate on here is cleaned well, because you can use these particular electrodes over and over again because these never touch your patient. So as long as this is clean and you stick these on there, they will continue, they will last a very, very long time. So pull one of your oval electrodes off. It fits perfectly on that metal plate, almost like we had it cut like that, which we did. Then plug into your white cable here. And I'm going to connect up the visible male end and leave the shrouded end. And on this, you want to connect it up with one of the these electrodes. Plug that in. So now the only thing left to do is to take your ear clip and connect it to the black cable. So to test it, turn the device on, put the clip on your finger, pull the electrode up, and touch the electrode, and the light should go out. So at this point, you don't have to touch the metal plate because the circuit is connected. Okay, so there are several different ways to apply this therapy. The most commonly used way to apply this therapy falls into kind of 2 different attachments. One is to take this cable and put it on your left earlobe. Again, we find generally the left earlobe to be much better for bringing conditions down. And you want to take the other pad and either put it on the wrist right here, and you'll notice that that puts it directly over those 3 acupuncture points we talked about earlier, which are the golden triangle. So these parasympathetic calming points, so electricity is going in, forcing down the vagus nerve, and then also coming out through these acupuncture points right here that are calming points. The other presentation you can use is to take this electrode and go 4 fingers above your belly button and connect it there. Now you'll notice in the manual that comes with this, it tells you to go below the belly button. You could do that as well, but in some testing we've done lately, we found that going above the belly button can actually add to the efficacy of the treatment. So that's kind of the ongoing, most recent development in vagus nerve stimulation. In doing so, you're putting electricity into the vagus nerve and bringing it all the way down, actually following the vagus nerve down. There are a lot of devices that use 2 ear clips for vagus nerve stimulation, and you can't really say that you're doing vagus nerve stimulation if you're doing that. You're definitely doing transcranial microcurrent, but you're not necessarily following the vagus nerve. So to my knowledge, we're the only device on the market that actually follows the vagus nerve down its entire path. Occasionally, you will see presentations in the book where it talks about putting the electrode on your right ear and using a positive polarity. That's generally for bringing things up. So you're going to put this on your left ear. You're going to put this on a negative polarity. You're going to turn the device on. Obviously, it's not going to be on your shirt. It's going to be on your skin. And you're going to push this continuous treat button. And this light will flash most of the time. If you put it on a positive polarity, the light sometimes will not flash. But for right now, you're going to keep it on a negative polarity. You're going to let this run the first treatment. You're going to let it run for about 5 minutes. And I typically do, even when I'm sending these devices home with patients, I do an in-office treatment for 5 minutes the first time. I just want to make sure the patient knows how to put the device on properly. And I want to watch the patient to make sure it's not too sedating for them. It's rare for that to be the case, but occasionally you find somebody that they find it to be very, very sedating. And what that does is it helps me tell the patient how long to use the device. So in typical use, you're going to use, the patient's going to go home, they're going to hook themselves up, they're going to use device for 5 minutes in the evening, and then they're done. The next day, they're going to add 5 minutes to the treatment. And as long as they don't feel too sedated, they're going to keep doing that until they hit the 20 to 30 minute mark, depending on what I tell the patient they need to do for treatment. So that, that allows you to slowly build up the overall, I guess, volume of vagus nerve stimulation that the patient is using. Typically, patients will start to see some results in terms of changed sleeping patterns and feeling more refreshed, sometimes in a day or so. So these are safe to use with children. I use them on my children. I currently have a couple of kids right now who are autistic, whose parents are applying these devices in the evening. The kids go to sleep a lot faster, and they seem to have a lot less fear issues during the day, because fear is a big issue in autism. They kind of have an overactive amygdala. And I had an autistic stepdaughter, so I've had a fair amount of experience treating autistic kids. So this is a really useful device for this. But it also works very well for anything that has to deal with systemic inflammatory problems. So when you do vagus nerve stimulation, what it will do is it acts as a neuromodulator. So it will start to change some key things in your system. So it will bring up your heart rate variability, which is sort of your resilience to stressors. It will bring up your high frequency vagal tone, which is your ability to cope with stressors once you have them. So what that does is it initiates recovery faster, helps your body recover from things. And these devices, the vagus nerve stimulation portion, we originally developed for use in elite athletes. So Olympic level runners and people like that who tend to get overtraining syndrome, this resets their system much faster so they continue their training schedule. We developed the vagus nerve stimulation setup before COVID started. And so when COVID hit, we started looking at the numbers, and everything you need to recover from COVID in terms of recovery numbers is what this generated. So this device does actually have a medical indication from Health Canada for acute respiratory distress with COVID. And it also has a medical indication from Health Canada for long haul COVID. So anyway, I think it's probably the only medical device on the market that has an indication for long haul COVID and acute respiratory distress. And I personally used this when I had COVID, and it was responsible for bringing my my oxygen saturation from an abysmal 81 up to about 92 in about an hour or two. So it was really the difference between me going to the hospital or being able to stay home and recover from COVID. So I'm very grateful that it was able to do that. And about 2 weeks ago, my son, who has never had any severe respiratory problems, had bronchospasms in the middle of the night. He had essentially a really bad asthma attack It was so bad, in fact, that when I got upstairs to check on him, his face was starting to turn blue and he was looking like he was going to pass out. And I was able to use one of these devices to treat an emergency acupuncture point on the thumb, which is called lung 11, which is used for acute respiratory distress. So I use it to actually stop the asthma attack. And I've done that about a dozen times in my career, and every time I've done it, it seems to have worked. So this is a really, really useful device to have. I worked in a lot of neurology and neurosurgery clinics over the years. I've used this for migraine headaches consistently, works very well. There are some specific acupuncture points for migraines. Vagus nerve stimulation works extremely well for migraines. So if you have migraines, put this on, lay down in a dark place, and usually in about 10 to 15 minutes, the migraine will start to ease up and it will usually evaporate. That's been the experience of most of my patients. I've also used this on neuropathy patients. I've used it on shingles, trigeminal neuralgia, back pain, neck pain, scars of all kinds, MS patients, stroke rehab. There's all kind of places where you can use this device. So any acupuncture points, any acupuncture protocols that you come across, you can typically do with this device and usually have pretty good effects. All right, so we've gone over how to pull the device, how to change batteries, how to locate acupuncture points, trigger points, and motor points. You can actually hold this device directly over myofascial trigger points, and it will reduce the sensitivity of those points and reduce the referral patterns. So that's a useful thing. We've gone over how to treat scars. We've gone over how to hook up vagus nerve stimulation. And we have gone over, let's see, contraindications. I used to work in an OBGYN office. Those doctors would write orders for me to use this device on patients who were pregnant, specifically for problems they were having, be it sciatic or whatever else. That being said, e-stim can be a contraindication for use during pregnancy. So you need to consult with a physician first, unless the physician is directly ordering the device. Don't stick these in places you wouldn't stick a pencil. Don't stick them in your eye. Don't stick them up your nose. It's okay to use them to treat inside your mouth, to treat scars. As a matter of fact, there's another piece of equipment that comes with the double kits. It looks like this, looks like a pen with a cup. If you put that cup on here, you can use this pen, it's bendable, to treat points on your back or even get inside your mouth to treat internal scars in your mouth. So this is a useful part of the kit. And let's see, we're coming up on about 8 o'clock. So I think probably what we'll do is open up the floor for questions. It's just gonna be a little bit tricky here because I had to change out my computer and use this phone to set up. So let me see if I can get to the chat function on here and see what kind of, oh, hey, Michael, how are you? All right, let's see here. Let's see what we have here.
I have a question.
What's that?
The one thing I'm struggling with is when I find a point.
Okay.
The green light's supposed to go on or off or what?
When you find the point, typically the green light will go off, but I really don't pay too much attention to the green light. It's the pitch of the machine that really makes the biggest difference.
And after I get that pitch and I hold the button in the back,
right?
Is there anything with the light it should be going?
The light oftentimes will flash. Most of the time it will flash, but if you are really nailing the acupuncture point, sometimes the light will go out and actually stay out during the treatment. But as long as you're holding that, yeah, that's fine. As long as you're holding the button down, you are absolutely doing the right thing. So there's no problems there.
Okay, thank you.
Sure. Let
Yes,
me make sure.
Hi, I have a question. You mentioned these this is great for use with strains and sprains, broken bones. Will it also help with like tendinosis or
Sure.
tendinitis? Yes.
Yes. What you have to remember with things like tendonitis type things is that typically so I treat a lot of things like tennis elbow and plantar fasciitis and things like that, where there are tendinous structures attached. And the bulk of the outcomes I get come from treating in the belly of the muscle itself that's attached to the tendon.
Okay.
But also it's important to look at what innervates that particular a muscle. So I'm going to show you kind of a poster here. So these are available. This is a dermatome poster. So I'm going to give you an example of how you would use this. Okay.
Okay.
So let's say you had a patient who had plantar fasciitis. Okay. So we know that this is where the patient typically hurts.
Okay.
Well, let me see if okay, here we go. We know that this is where the patient typically, let's see, I'll do it on the side. Well, I'm going to move over here. So we know that this is where the patient typically hurts. And we know that the patients are generally told to stretch this muscle. We know that people do a lot of manual therapy in this muscle because that's what pulls on this area, right?
Right.
Okay. But where things tend to fall down and what people tend to forget is that something has to perpetuate the muscle contraction here to pull on this. So what people miss out on is the fact that if you look at a dermatome chart, like this shows you that this is S1 and S2. So the S1 and S2 nerve roots are what feed these muscles that are pulling on this. So very often you have to go up and go to the sacrum and treat over the sacrum, because if you have nerve root entrapment in those areas, so what we call subclinical radiculopathy, it elevates the levels of acetylcholine down those pathways. And acetylcholine is a neurotransmitter that makes muscles contract. So that perpetuates a problem. The same thing goes for tennis elbow. So when I treat a tennis elbow case, what I will typically do is I do what's called our standard protocol. So if you take one of our workshops, you'll see how that works. But we actually treat the low back first. So when I treat the low back and balance the hips, that's typically about 30 to 50% of the tennis elbow pain gone right there without ever touching the elbow. And then I go and I treat the neck, because I know that the scalene muscles can put a lot of pressure on those nerve roots that feed down into here. And that's usually anywhere from 10 to 30% right there. So at that point, you're up to probably about 80% reduction in overall discomfort, and you've never even touched the elbow itself. If you take one of these devices and you go straight to the area where the tendonitis is and hold it over that area, what'll happen is that it will make it feel better for a little while, but you're not really addressing the cause of what's going on. So you end up with these revolving door patients. And these are the patients who are going, they tell you, oh, I have tennis elbow, but I just go and get an injection every 4 to 6 months and it's fine. Well, it's not fine because nobody's fixed the problem. You're just putting a Band-Aid on it every single time. So if you track it back, you're going to get much better outcomes with your patients. And we look at back pain and neck pain and hand pain, all of that. We look at dermatome charts to see what vertebral segments are involved. And I think you're going to find that helps out quite a bit.
And you said you have workshops for this?
We do. Yeah. If you get on our website, you can get signed up for them. Some of them are in person, and we do have some online workshops available as well. And they are live online workshops. We do have some pre-recorded stuff, but there are live online workshops as well. So there's a pretty good list of those things available.
Oh, excellent.
And if you live in an area and you'd like to have a workshop in that area, if you can drum up some people who are interested in taking it, we can send an instructor your way.
What's the maximum attendance that you need?
I think it's either 10 or 12 participants. It's not a lot. Okay. But you got to keep in mind, like, we got to pay for an instructor's flight to get there. We got to pay for an instructor's hotel to get there, and typically a conference room somewhere. So that incurs a fair amount of expense, and we got to pay the instructor to be there as well. And then somewhere in there has to be a little bit of money for Acumed itself for actually having put on the workshop. So, we just have to have enough to make it worthwhile. We don't need to make $1 bazillion, but it just needs to be enough to cover all the expenses.
Got it. Okay.
Let's see here. can find, the problem I am having here is that with this cell phone, I do not seem to be able to get to the chat section. So if you have typed a question on here, let me look. Maybe I can pull it up this way. No, if you have typed a question on here, I cannot read it at the moment. So if you want to raise your hand and Hetvi will cue you and you can go ahead and ask your question. And I apologize for that, guys. I just had the camera froze on my computer. It seems to be an ongoing issue here. So anybody else have any questions for us?
I have one more for the tendonitis of the, real quick, the tendonitis of the elbow. What's the first you would treat?
I would do the standard protocol first. So remember the low back protocol that we did during the workshop?
Right.
I would do that first because that's going to affect everything in the neck. So I would do the low back standard protocol. Then I would go up to the neck and I would treat the neck. So do those neck points that you learned. And there's actually, there should be in the protocol book you have, there should be like a hand and arm pain protocol. I would then use that. So that'll probably incorporate a few points around your fingers or something around the elbow.
Okay, thank you so much. Thank you.
You are very welcome. All right, other questions?
I have a number of questions. So I've been doing the vagal nerve stimulation. I have severe asthma and I have long COVID. My sister got me the device. So I was doing the vagal nerve stimulation and like sometimes I'll get like a heartbeat sensation and sometimes I don't. Does that matter?
Well, what you just feel on the electrical pulse in your ear. So I personally find that to be pretty uncomfortable. Like it drives me up a tree. So I typically just roll it back. So you just turn it down so it's comfortable. So it's not going to affect the overall treatment. You know, leave it on for a couple more minutes and you're fine. So how's your long haul COVID doing?
Well, I've only been using it for a little while. For a couple weeks. So, and I'm not 100% sure I've been using it all correctly. That's why I came tonight.
Okay, so what part of it do you think you may be having problems with?
Well, I wanted to check, like, because I was like, okay, I don't feel the heartbeat. Like, am I doing it wrong? I didn't know if I was supposed to feel that or not. Like, I kept trying to like mess with it and figure out like, why is it not doing it now?
Right.
So, but if I don't have to worry about that, that's fine. And then, so I guess I'm a little overwhelmed with how to pick the points because I have so much going on with respiratory and fatigue. Like there's so many points I could pick. You know, like the thumbs, you know, I've been doing the thumbs and I've been trying to do the auricular, but I'm not sure how pinpoint I am on that. And then like, how do you pick?
Okay, well, the thumbs, the points on the thumbs and fingertips are for acute, almost emergency type situations.
Oh, okay.
Like an asthma attack. There are points on here for heart attacks and strokes and
okay.
So those, like if things get really bad really fast, that's when these points come into play. It's not that they're bad points to treat, but they're not ones you would typically use. So if I were treating you for long haul COVID, I would say if you can treat these points on your wrist, that's a really good place to go because those are points that affect your lungs and the chest. And the other thing you get with long haul COVID, you get a lot of brain fog. So one of the things that this device does is it actually lowers systemic inflammation, which is kind of a big deal for that. You know, you might also check with like if you've got a nutritionist or something like that, or somebody who does supplements. I know that they're like I can't give you advice on that kind of stuff because that's not my background. I can tell you that personally myself, after I had COVID, I took a lot of Cordyceps militaris, which is just a mushroom extract, and that was recommended to me by a nurse practitioner who does have a background in supplements. So anyway, that's so anyway, that's one of the things that was helpful for me. But are you having breathing difficulties?
Oh, all the time. Like I had pneumonia 6 weeks ago. So I had COVID 2 years ago and I already had asthma and like, it's just never.
Okay. So if you get something like pneumonia, that's one of those things you actually want to dry it up. And if you look in your charts, there are some points around on the chest. I would actually put the device on the positive polarity and treat over that point on the chest.
Mhm.
because you're actually trying to put energy in to kind of dry everything up. Does that make sense?
Mhm.
So it's kind of like using heat instead of ice kind of thing.
Okay, so negative on the wrists.
Yes,
Okay.
yes.
All
And
right.
now if you have an acute presentation of something, I would start, I would use negative most of the time, but sometimes positive is used to kind of bring your system up. And you might want to write this acupuncture point down. There's a point called K3, kidney 3,
Mhm.
is down around the ankle. And that is the source point for kidney energy, which is your life essence. So
Okay.
if you tonify that point, it typically helps kind of bring your energy up.
Okay. All right.
Okay.
Yeah.
And make sure you get tied into the online forum. And all you have to do is request. It's on Facebook. Just request to become a member, and we'll get you guys approved. So that when questions like that come up, you can post. Our instructors get on there pretty regularly and answer questions for you guys.
Okay, so I want I'm sorry, last thing I promise. So I want to do no more than 30 minutes of everything, including the vagal nerve stimulation. Like that's the max for everything for the day.
Is that the limit you're setting, or is that what you're
I'm
saying?
asking because I read that also like you can do it too much to where like too much is not good either. And I'm like, well, I don't know what's too much.
If I were in your shoes, I would probably be doing about 20 minutes of vagus nerve stimulation. I would do probably 10 minutes of vagus nerve stimulation where you have a pad on your wrist, and another 10 minutes on the wrist, left wrist, and then another 20 minutes, 4 fingers above the abdomen. So for a total of 30 minutes plus the acupuncture points.
Okay, yeah, I've got a lot going on. So, okay,
so
cool.
when you get into these chronic conditions, things like mold exposure and stuff like that, it just takes a lot to dredge you out of that trench. Like it's a, you'll get there. Like I'll give you an example. Like a friend of mine opened her own clinic. She was a nurse practitioner and worked there for a year. She didn't know the place was completely eaten up with black mold, and it made her incredibly ill. And she had to close her clinic, sell her house because there was a little mold somewhere in the house that she couldn't find. She had to move into a trailer because those are built in a warehouse, so there's no mold anywhere in them when you first get them. And she worked from her bed, working as an online professor for a university because she couldn't even get out of bed. And I sent her a vagus nerve stimulation setup. She already had the device, but I sent her the vagus nerve stimulation setup, and it took a couple months. But after a couple of months, she got her brain back, and was able to get back to work, and all the chronic pain that went with it evaporated. But it did take a couple of months. So, hang in there. It does initially work kind of slowly on that, but it's going to build for you. Okay.
Okay, thanks so much.
Sure. All right. Other questions? What have we got? We still got about 20 minutes or so.
Mine's kind of similar to that one. So I just a little extra question. I've had COVID, long COVID for 12 weeks.
Okay.
And I've had the unit, I've had the unit for a week now, and I noticed the difference after the first 3 days, which is awesome.
Okay.
So now I just want to know what I was doing was 15 minutes on the left ear, and then I would do the golden triangle on both wrists just to reset.
Right.
And I also did the GB41 spot before bed.
Okay.
Can I now do that twice a day, once in the morning, once at night, or would you suggest just keeping all the treatment to the evening?
It's really going to depend on what it does to you. For example, like if you do it in the morning and you find you're so sedated you can't really make it to the day, I mean, it's not going to hurt you. Like it all contributes to your recovery. So it may be that you want to do 30 minutes of vagus nerve stimulation in the evening. Now, I've seen people who are really ill who did this 30 minutes in the morning and 30 minutes in the evening. But again, at some point, you're going to find that it does become kind of sedating. And so you have to think of it like this. So your system is brought way up by these problems, your level of sympathetic arousal. And when you apply vagus nerve stimulation, it brings it down. So it starts to swing it down. But if you swing it too far down, it has a long ways to come up to get back to normal. Does that make sense?
Yeah.
So,
okay. Like I'm homesick anyways. Like I'm home on sick leave. Like I'm that bad. I had internal shakes, and so I can't even work right now. Like I've been off anyway. So I'm just kind of trying to get it back. Do you know what I mean? Like bring my level back to normal.
This is what I would suggest. I would suggest do your acupuncture points in the morning. So do your acupuncture point treatment in the morning. And then in the evening, I would probably go for a full, like if you slowly build up to about 30 minutes of vagus nerve stimulation.
Okay.
And you'll notice it on the vagus nerve stimulation book that comes with the device.
Yeah.
They do actually have you using it on the right ear on a positive polarity for part of the time. As you get a little bit farther along in things, you might use that to kind of bring your system up a little bit, but I wouldn't do any more than about 5 minutes on the right ear. And if you're going to do any stimulation on the right ear, do that in the morning. Don't do it in the evening, because that can interfere with your sleep a little bit.
Yeah, I haven't done any of that. But if you put the ground pad on your wrist, right?
Yes.
Do you treat that? Do you treat that afterwards, like with just the acupressure, or no?
Sure. Yeah, I would go ahead and treat those points, because the pad is pretty dispersive. So it's very gentle. But when you use the tip of this really concentrates the electrons in the area, and so you're going to get a more intense treatment. It's going to kind of go directly more to the point.
You can do the golden triangle even after that, like after you're done, just to reset everything. Yeah.
Definitely.
Okay. Awesome. Great. Thank you.
All right. What else have we got?
Yeah, I have a couple questions about VNS.
Sure.
Can it cause detox symptoms like diarrhea and fatigue?
I've never seen it cause diarrhea. Unless you had some kind of disorder, and I guess you had kind of like a detox reaction, I guess. So one of the things it will do is this. So as you, they say there's a brain gut connection, right?
Mm-hmm.
And the amount of stress that you have. So things that affect the biome in your gut are a variety of things. Like the food you eat is definitely one of those things. You got to get off of sugar, and you got to get off highly processed wheats and those kind of things.
Mm-hmm.
But the amount of stress that you were under, I actually was reading a study just a couple of days ago. The amount of stress you're under, mental stress, actually affects the biome in your gut. So if your gut is highly dysfunctional, and you start doing vagus nerve stimulation and reducing the overall stress load, that's actually going to change it's going to balance out the growth patterns of stuff in your gut. So I guess it's possible you might have an initial reaction like that as things balance out. I haven't seen it. I'm just kind of, based on what I know about gut biome stuff. Fatigue, if you feel like you're fatigued immediately afterwards, I would back down on the amount of vagus nerve stimulation you're doing. Just cut it down by 5 minutes or so until you don't feel fatigued, or look in the vagus nerve stimulation book and use that right ear stimulation on the positive setting, and that should bring things back up for you.
Okay. Have you seen it kill parasites? Have you heard? Is there any testimonies of that?
We haven't really done any studies on that,
Okay.
so I can't even really speculate. It's kind of, that's not even within my scope of ability to speculate.
Okay.
I know people I could ask. So I'll tell you what, why don't you go to the forum and post on there, and if there's somebody who has some experience with it, they can probably say something to you about it.
Okay. And then during a treatment, if somebody's wearing like an Oura ring or a Fitbit, should they take those off? Will that interfere?
When you're doing traditional acupuncture, definitely taking jewelry off is important, because when you stick needles in people, you're affecting the bioelectric field of the body. I mean, you're creating electrical disturbance. But those needles don't have an electricity source. These have a 9-volt battery in them. So I don't really think it's necessary to do that. It's not going to make that much of a difference. I mean, it's not like if you're treating patients, I typically ask my patients to take their jewelry and stuff off anyway, just because it's easier for me to get to acupuncture points I need to get through. And we do some body work in my office anyway. But I wouldn't get overly concerned that the Fitbit's going to interfere with your treatment. This is pretty overwhelming on the acupuncture points. It's not like a needle. Like if a needle is a feather, this is a hammer.
Okay. Okay, just one more question.
Sure.
I'm struggling with finding professional liability insurance coverage. I am not a therapist. I'm a retired licensed nursing home administrator, and then I do quantum feedback and you know, that kind of a thing. So I'm not licensed,
Right.
and I'm struggling with finding coverage.
Where are you?
Iowa.
Iowa.
Alternative balance, I have coverage for like my quantum feedback business that I have, but they won't cover this because they say it's like a TENS unit and they don't cover that.
There is one person I know in Iowa that I might be able to ask. I just don't know. And things vary so much from state to state. So I don't know much about, you know, what you would have to like, what certifications you would have to get coverage there. It really does vary from state to state. So I wish I could give you an answer for that, but I would be just guessing if I did.
Okay, I'll just.
Yep. So post that one on the forum.
Okay, I'll do that.
And that way it'll, you know, be a little bit of a squeaky wheel there, and we'll see what we can find out for you. Okay.
Okay, great. Thanks.
All right. What else we got, guys?
Can you hear me?
Yes.
Is this helpful for osteoarthritis in the hands, or would the vagal nerve reset help just reduce the overall inflammation?
So if you do vagus nerve stimulation, it reduces systemic inflammation. I've been a massage therapist for 27 years. So as you can imagine, I've had some wear and tear on my fingers. I do have some arthritis in my fingers. And I can definitely tell you that if I go home and eat a bunch of sugar tonight, tomorrow is going to be a bad day on my hands. So you definitely need to be watching the inflammatory things you put in your body. That being said, I can definitely tell you that using this significantly reduces the inflammation. So it does make a difference for me and my hands. And I usually treat myself probably twice a week with this. I don't go overboard with it. So yes, and you can also take this and go directly over the tender points in your fingers where you have arthritis. And you will find that significantly does help. And it's kind of on the bottom end of sophistication. It's not terribly sophisticated, but if you just take this and stick it where it hurts with arthritis, generally speaking, you're going to have significant relief in that area.
Terrific. Thank you.
Build up.
You're very welcome.
Start 5 minutes and build up.
I'm sorry, what?
So with the vagus nerve, do we start at 5 minutes and then build up time from there as we go?
That seems to be the best strategy for people. You just don't know how profound the response is going to be with people. And you're just trying to keep the device, you're trying to keep yourself from swinging too far down. So
Okay.
I would start with 5 minutes and just add 5 minutes a day. And if any point you find that you're getting fatigued, I would say that's a good number to back off of just a little bit. And that should give you, that should kind of get you where you need to be. And if you're a healthy person and just using this for general maintenance, once or twice a week with vagus nerve stimulation tends to be enough.
Okay. Good.
If you are an athlete and use and do really intensive things, you definitely want to wait 3 or 4 hours after your workouts, because you're in high sympathetic tone after a workout. So if you wait 3 or 4 hours on the downswing and use this swings it a little bit farther down and kicks off the recovery process. Now, if you are suffering from something like chronic mold exposure or long haul COVID or something like that, or acute COVID, I would be using this every day, sometimes a couple of times a day.
Okay.
Okay. Thank
All right.
you.
Thanks. Awesome.
Sure. Anything else, guys?
Hello?
Yep, I'm here.
Joe, with the Vegas, when we connect everything, we put it on, you said we're supposed to hear something?
So typically would you put the ear clip on and you put the electrode on your tummy, the pitch of the device when you turn it on should go up. You should hear a high pitch.
Got it.
Does that work for you?
You don't hold the button or anything.
Yeah, so that little tiny button, you push that one, that puts it in the constant treat mode. And at that point, it's going to go silent and you'll see the light flash on it.
Do I have to hold the button?
No, if you push that little button and it goes silent, it's going to go for about 12 to 14 minutes. And then it'll turn itself, it'll go back into search mode.
I got it. And
So
I
you
I
can-
go on negative, right?
So you can stick it in your pocket and walk around, or you can sit back and read a book or listen to music or whatever while it's going on. So you don't have to hold that button down.
And it's negative.
Yeah, definitely, definitely negative for most of the things you want to do.
Yeah, I've been using it. I got it for my clients and I've been playing
Okay.
it with, I've seen some changes already. I did
Oh.
the SOAS release the other, after an hour after I came home yesterday.
Uh-huh.
Seminar, and I worked it today, so I'm gonna work it in with my clients with training and all the other stuff, but
That's SOAS release is a big deal for just about everybody. And I imagine, when you start getting into training people, that's a muscle that really needs a little bit of attention. That affects your ability to lift things.
Yep. And that button's the red lights, the green light's supposed to go on?
When you push it so I don't know if you can see this. So I'm going to turn this device on and I'm going to push this little button right here. And when I'm turning it over, you see that it's flashing.
I can't see it.
Oh, let's see here. Let's see. Can you see the flashing on there now?
No. I don't
I'm sorry.
see it.
Yeah, just bad camera stuff, I guess.
So so basically I turn it on,
Yep.
it's making that noise.
Yep.
And when I hit with the silent thing, it's not
Right.
making a green. Does the green light go on and off?
Yeah, the green light will flash some.
It doesn't.
Sometimes. You're good. That just means it's well connected. So,
All right.
yep, you're good there.
All right, thank you.
Yes, sir. All right. Anybody else?
Yeah, I have one more question.
Sure.
I'm not a massage therapist, and so sometimes I struggle with finding acupressure points. Is it just keep practicing to find them?
Well, I'll tell you, I'm a massage therapist and nobody ever taught me any acupressure or acupuncture points when I was in school. So if you just play with this a little bit, you
Okay.
will, the more you play with it, the better the patient's going to. The nice thing is these things are pretty forgiving. So if you're close to the points, you're going to get outcomes. I can tell you that personally, it took me, I was trained probably 20 years ago, but it took me about 2 weeks of playing with this a little bit every day. So I would go home and mess with this for about 15 minutes or so on myself or my kids or whoever I could get a hold of. And that really helped me hone in on my ability to find points. You just need a little bit of practice. I promise it comes fast if you spend a little bit of time with it.
Okay.
And you can actually get online. There are some tutorials. There are some online on apps that actually show you the acupuncture points, like where they're located, and give you a little explanation for them. And those are usually free to download.
Do you know the name of them? The apps?
There are so many of them out there.
Really?
I couldn't even.
Okay.
Yeah. There's lots of. There are a lot of resources online, and there are even people who do little YouTube videos on how to find specific. Like if you type in YouTube spleen 6, somebody will probably do a video on how to find spleen 6 for you.
Okay. All right. Perfect. All right. Thanks.
Sure.
What is the
Alrighty.
name of the Facebook group?
What else?
The name of the Facebook
Hedvig, can you
group
help?
is, yeah, sure. So the name of the Facebook group, like we have two groups. One is Master Dolphin Stimhead, and the other one is MPS Therapy Pain Management. So I did send a presentation to you, to all of you, in an attachment. And when you go towards the end of it, there's like 2 barcodes given. You can scan the barcodes and you'll be able to join the network.
Thanks.
Or even I can share the links of the groups here if you are able to copy and paste it somewhere, because soon we'll be able to, we are ending this call. So if it will be easier for you to copy and paste it somewhere.
Okay.
Sure.
Oh, there it is.
Yeah.
Yeah, I just saw it come up.
I have a
Yes.
quick question. Are
Okay.
we going to get this recording? Because I was
Yes.
just looking through the book and I'm like, there are some nuances that you mentioned that are not in any of the things I received.
Right.
Yeah, definitely.
Yes.
You'll be able to see the recording tomorrow by the end of the day. Yeah, we'll email
right.
you guys. Yeah,
Thank you.
no problem.
All right. Are we good, guys? We're right at about 8:30, so we can take maybe like one more question. Everybody good?
I have a question. I mean, it doesn't apply to everybody, or maybe I also I purchased the online courses and I'm going through the first one now, about to finish and doing the second one.
Okay.
But I also see the one for the ears. Is that necessary or it's just additional?
So the introductory workshop is the core workshop. And from that point, you kind of branch out into whatever, if you're going to do concussions or you're going to do ears or whatever. It's not a necessary one. The ears are nice because you can treat the entire body through the ear.
Okay.
The military does a lot of ear acupuncture, and we have done some training for the military in the past. So, you can actually release the psoas muscles with an acupuncture point in the ear. There's a couple of really good allergy points. Anything you can do on the rest, there's a microsystem in the ear. So if you do the ear workshop, you're going to learn how it's not a different system, but a different way to approach some of these things. Because there are some people who, they don't want to take their clothes off, or they have wound dressings, or they have casts or braces or something like that don't allow you to get to those areas. So if you know the points in the ear, it has a pretty strong effect on your ability to get outcomes with these patients.
Okay. Well, right now I am finishing up the intro, and I also bought the SCAR one. So I'm just trying to figure out what should be next.
Right. I would say the introductory workshop and the SCAR workshop are your two like super duper big ones.
Mm-hmm.
And that gives you the background you need for all the other things you might want to do. So if I had to pick two, do the introductory one and the SCAR one, and then kind of pick and choose your other ones. I mean, they're all useful, but it just depends on what kind of patients you're treating.
Okay. All right. Thank you so much.
Sure. All right, guys. So we are past 8:30 here. So I have got to get home and feed my children. I'm sure they're going to be pretty hungry. I have to come to the office to do that because if I try and do this at home, every little emergency, everything's not an emergency becomes an emergency. So now I got to go home and feed my kids.
Thank you, Joe.
So
Thank you.
thank you guys for coming out. Thank you,
Joe.
Hedby, for hosting us on
No,
here.
no problem. Thank
Good
you,
seeing you,
Joe.
Michael.
Yeah.
Thank you. Thank you,
All
Joe.
right.
Thank you so
guys
much
have a
for
nice
coming.
evening, okay? Oh, you're welcome. All right. Bye, guys.
Bye-bye. Thank you.
Thank you.